When you hear the word health, what's the first thing that pops into your head? For most of us, it's probably things like jogging, eating salads, not getting the flu. And that's the picture we all have. But here's the thing, that picture is decades out of date. Today, we're going to look at how our entire understanding of what it means to be healthy has been completely transformed.
So let's just pause on that for a second. I'm really asking you to think about it. What does being healthy actually feel like to you? Is it just about physical strength, or is it peace of mind? Maybe not having to worry? It seems like such a simple question, but the answer? Well, it gets complicated fast.
And this slide, this really shows the old view versus the new view in a nutshell. We used to think health was just the absence of disease. Simple, right? If nothing's obviously broken, you're good to go. But now, look at the modern definition from the World Health Organization, a state of complete physical, mental, and social well-being. It's not about what's missing anymore. It's about the richness of what's present.
Now, this wider definition, it forces us to stop thinking about ourselves as just a collection of parts to be fixed, kind of like a car in a repair shop. Instead, it pushes us toward a much bigger idea, looking at the whole person.
And the key principle here is this concept called holism. It's a simple but really powerful idea that all the different parts of you are interconnected. You can't just treat one part without affecting all the others. Think about it. A support worker can't just focus on a physical issue and totally ignore a person's beliefs, their family life, or their emotional state. It's all one big system. So if we're going to look at the whole person, what are the pieces we're actually talking about? Well, we can break it down into these 5 key dimensions. There's the physical, of course, that's the obvious one, but just as important are your emotional resilience, your social fabric, your spiritual or personal values, and the cultural world you live in. Real health is about finding a balance across all of them.
Okay, and this brings up a really subtle distinction that I find fascinating, the difference between health and wellness, because they aren't the same thing at all. Health is your state of being. It can change day to day, it's dynamic. Wellness, on the other hand, is the active process you choose. It's a lifestyle you build to create balance. This means you can have a chronic illness and still be actively pursuing wellness. It's a choice, a practice, not just a condition you're in.
But, okay, if wellness is a choice, it brings up a tough question. How much of our health is actually in our own hands? This is where things get really complicated, because honestly, in so many ways, our health is a lottery. It depends so much on the cards you were dealt the day you were born.
12. What's that number? Well, according to public health experts, that's how many key factors that determine your health are largely outside of your personal control. Just think about that. That one idea completely challenges the whole story we're told, that being healthy is just about making good choices.
So what are these factors?
Well, the first big group is socioeconomic. Things like how much money you make, your job, your education level, even what you went through as a kid. These aren't lifestyle choices, right? They're the very foundation that your future health is built on.
And then there's your environment and your social world. Like, where do you live? Is it a safe place with clean air? Do you have people you can actually count on when things get tough? Can you even get to a doctor when you need to? All of these things have a massive daily impact on your well-being.
And on top of all that, you've got these deep biological and systemic factors. You don't choose your genes, and your gender or your race can affect not only your health risks, but also the quality of care you might get. It reframes everything. Even so-called healthy choices are really just a reflection of the opportunities you actually have. So the unavoidable truth here is this. You can do everything right, eat the kale, run the marathon, meditate every single day, and still get sick. Your genes, a random accident, something in the air, it can all change in a heartbeat. Prevention is absolutely vital, but it is not a perfect suit of armor. And that leads to a reality many of us will have to face, because illness and disability can happen to anyone, at any time. So what happens then? When your health takes a turn, how do you even begin to process something like that? For many people, there's a recognizable emotional path. It often starts with shock or denial, that feeling of, no, this can't be happening to me. That can give way to anger and frustration at the sheer unfairness of it all. Then comes sadness and grief, which is a natural part of mourning what you've lost. And over time, that whole process can eventually lead to a new place of adaptation, learning how to live with a new reality. Because we really have to understand that when a serious illness arrives, it isn't just a medical event. It's a life event. And at its very core, It is an experience of profound loss. So what exactly is lost? Well, it can start with things like your independence. Then maybe your role in the family changes. The caregiver suddenly becomes the one needing care. Your job and your finances might disappear. Your social circle can shrink. And when you add all of that up, you're left confronting the biggest loss of all, your actual sense of self. When your abilities, your roles, your entire future are all thrown into question, the real challenge becomes, who am I now? And that is why compassionate care has to address the whole person. It's not about fixing a body. It's about helping a human being navigate a fundamental shift in their identity. So when we put it all together, this new definition of health, the lottery of factors we can't control, and the deep personal impact of illness, we're left with a much richer, more honest, and frankly, a more human way of looking at things. Which leaves us with this one last thought. Knowing all this, knowing that health is so much more than just a personal choice, how does that change the way we show up for each other? Maybe the next time we're about to give some simple advice, we can just pause. And instead of judging, we can try to understand the whole person standing in front of us, their struggles, their circumstances, their entire story. That shift, right there, from judgment to compassion, that might just be the healthiest thing any of us can do.